ladies and gentlemen, to today's tutorial. Today we want to look at two of the flat bones that form the thoracic cage. They are the ribs and the sternum. Now, if you talk about the thoracic cage, actually it's not only these, but you also include the thoracic vertebrae as well as the adjoining intervertebral disc. Then of course you don't forget this costal cartilages as well. But if the question goes that if you talk about the bony thorax components, then go with only rib, sternum, and then of course thoracic vertebrae. Now, when we talk about the sternum, the layman will call the sternum the breastbone. Now take it, this is the sternum, this is the outline for the sternum. The breastbone, it is somewhat T-shaped. And then this is the anterior aspect of the bone. And then of course, this is the posterior aspect of the bone. Now, the bone actually consists of three components. A superior portion, which is known as the manibrum, or the manibrum sternum. There's the manibrum. And of course, a larger portion, which is the middle portion, known as the body, or the gladiolus, or the sternibri. The body of the sternum. And then we also have this small shaped structure, usually in the young age it's cartilaginous, and this is the xiphoid process or the xiphysternum. Now we've seen that these are three bones, therefore they are joined at some point. Now in between the manibrum and the body of the sternum is the manibro-sternal joint that we find here. In between the body of the sternum and the xiphoid process will be the xiphy-sternal joint. Xiphy-sternal joint. Now, what happens is that on the manibrum, superior aspect of the manibrum, we can see this notch. This notch over here is the supra above it, so suprasternal joint. Suprasternal notch. This suprasternal notch, because of its relation with the jugular vessels, we also call it jugular notch. Jugular notch. The jugular notch is very important for the reason that in the diagnosis of aortic arch aneurysm, the pulse felt over here is very important. It's very important in the diagnosis. Now, when you look just away from this suprasternal notch, there are two notches on either side, and that is the clavicular notch. So there are two clavicular notches on either side. This clavicular notch is for articulation with the sternal end of the clavicle to form sternoclavicular joint. Apart from these notches, now you find that there is a notch over here where it is occupied by this hyaline cartilaginous structure, which are known as costal cartilages, which you get to know later. There is one notch here, another notch, another notch, another notch. So in all, you have 1, 2, 3, 4, 5, 6, and 7 notches. Okay, but you find 1 on the manibrum, and then you have what you call 6 on the body. Okay, on the body, as well as the xiphy-sternal joint. Now these notches are known as costal notches because what happens is that the costal cartilages are going to help connect the ribs to the sternum. And so these are known as the costal notches. Now, this manibro-sternal joint, helps us in identifying the angle of Louis, and therefore this angle of Louis, or the manibro-sternal joint, is located or is related to the second rib. Now, once we get to know the manibro-sternal joint, you can palpate it, then you are looking at the second rib, and it can help you in rib counting. Yes, of course, also in identifying intercostal spaces. And there are other clinically important structures which are related to the sternal angle of Louis in our later sections we'll get to know. Now, the xiphoid process is also clinically important, yes, because during CPR, cardiopulmonary resuscitation, if we do artificial, respirations helping someone with cardiac arrest to get restored or to get consciousness level, then what happens is that this xiphoid process needs to be taken care of, because when you compress too much, it can actually, pierce through thoracic viscera, and it may be dangerous. So this is the sternum, and of course it is a flat bone, and that's what we have to learn about it. Clinically, the important ones, we've seen the jugular notch, we've seen the mandibulosternal joint, and we've also seen the xiphoid process. Now, the next part of this tutorial is going to be the rib, which is also a flat bone. Now, generally, if you take the rib, at its posterior aspect, in fact, this is the rib, these are the anterior aspects, so we can see this will be the anterior portion, but as you descend this way, we are getting the posterior aspect of the bone, because they are going to articulate with the thoracic vertebrae posteriorly. So this is the internal aspect of the bone. Now, its internal aspect, for you to know what happens, is that there is a groove in the internal aspects, and it's oriented inferiorly. This is known as the costal groove. Now, the costal groove actually transmits the neurovascular bundle. And what we mean by neurovascular bundle, what we mean is that they are the nerves and then vessels, simply with this mnemonic van. So vein, artery, nerve, they are the intercostal vessels and nerves. Now, if you look at this side which curves convex, is actually, the external part. It's actually the external part. There's no groove. Now, this is the head. Although it's a flat bone, it is having a head. Now, on its head, we find that there is a crest. On the head. And above the crest,